Zealand says it will be giving out masks on all international flights and strongly recommending passengers wear them, following new advice from the Director-General of Health. But the national carrier says it already has masks available on request and demand has not been high. Dr Ashley Bloomfield announced yesterday that he'd asked his team to look at the option of requiring all passengers to wear masks on trans-Tasman flights for the duration of the flight. Earlier, I spoke to Air New Zealand's Chief Medical Officer of Health, Dr Ben Johnston, and asked what the airline would be doing.
It's very likely it would be put in passenger announcements from the cabin crew. It would be reinforced around the time that the safety announcements are usually made. And then if there were occasions where people were choosing not to comply with that request, then our cabin crew would have conversations with those people.
So what about supply? Are you going to give the masks, and at what point will passengers get them?
Yes, there are already masks available on all of our aircraft, and that's something that's been in place since around about March of this year. So there is supply already in place.
So if a passenger were to ask you, sorry to interrupt, but to be clear on that, so if a passenger on any international flight were to ask for a mask, there would be one available on aircraft?
Correct, and that's been in place since March.
And how readily do people use those?
I can't quote you an exact figure. Uptake has not been high.
Right, because that's interesting. So if it's going to be voluntary but encouraged, when you board the aircraft, will someone be standing there pointing you in the direction to your seat and handing you a mask as well? Or are you going to wait for people to ask for them?
No, so this is part of the shift that's been signalled by the Ministry of Health is that a mask would be given to a passenger. We would not wait for them to ask for one. It would be given to them, and again through announcements from our flight attendants, it would be strongly encouraged that the passenger would make use of that mask.
And that would be at point of entry on the aircraft, do you think?
Well, certainly by the time that person is in their seat and before the aircraft takes off, that they would have that. I don't have the detail of exactly where in the boarding process they would get the mask, but the general intent, yes, is they would get a mask during the process of boarding the aircraft, getting to their seat.
Is it your understanding that it will only be flights coming from Australia rather than going from New Zealand to Australia?
Yeah, the interim direction we've received is that it's incoming international flights, so it's not only Australia. The priority was stated to us as Australia, and it was incoming flights.
So when did you first hear about this? Was it yesterday when it was announced publicly, or had you had a heads up?
There was an initial email indication on the day before yesterday, and there have been conversations happening with the Ministry of Health throughout the last few days, and then I understand there was an announcement in the media statement from the Director-General of Health yesterday.
So on broader issues, you're resuming passenger flights to and from Shanghai. Can you just explain to us what happens with your pilots and cabin crew on that route in terms of their safety and isolation and precautions taken?
Absolutely. So on all international routes at the moment, our air crew, if they overnight in an offshore location, they're required to self-isolate within their hotel, and there are very strict measures around that. They're not allowed to congregate and associate with each other. They're not allowed to go outside of the hotel. They're not allowed to use sporting facilities such as the gym or the pool within the hotel. They have to access food either within the hotel or have it delivered. With Shanghai specifically, that hotel there is a government-controlled facility. So the movement of crew from the airport, from when they go through immigration, their transport to the hotel, their stay in the hotel, and back to the aircraft again is very tightly controlled by the Chinese authorities. And there's a similar situation to that in Singapore. In other locations, so for example, California, this is not a government-controlled situation locally there, but essentially the same requirements are in place. And our crew have to wear masks and gloves when they move through the airport. They have dedicated crew transport that no other people are on apart from them and the driver. And then they go to their hotel and they must remain in that hotel and not leave the hotel at all until they get back in that dedicated crew transport to come back to the airport.
And that is Air New Zealand's Chief Medical Officer of Health, Dr Ben Johnston.